When looking for ways to reduce healthcare costs, you might not think to look closely at fraud, but the fact is $68 billion is lost to health insurance fraud each year. We're talking about fraud by doctors and other healthcare providers, fraud by insurance agents, and fraud by scammers, and that costs us all money. Medical Mutual of Ohio hasn't looked the other way, recovering $9 million last year alone. John Shoemaker's here to add up the ways Medical Mutual is fighting fraud, plus totaling the way seniors are targeted. John is the manager of financial investigation at Medical Mutual of Ohio. Thanks for joining us today.
Good to be here, Armin.
So fighting fraud is a full-time job. How does Medical Mutual help capture the con artists?
Well, it is a full-time job, and the way we've approached it is to develop a team of individuals with the right disciplines and years of experience. We have medical people, nurses, we have accountants, we have systems people, we have people with all the right backgrounds, ex-law enforcement officers, and we give them the tools they need with the experience they've had to combat fraud. And the tools I'm speaking of, we know we're in the digital age. All the information being transmitted today is electronic information, your healthcare information, and now, as you're well aware, your healthcare records are all going to be transmitted and digitized. But we have to step up to the plate and use and attack it in the same manner. In 2003, we purchased a product that not only analyzes and looks at all claims paid, but it also provides us with the ability to data mine, to do some predictive modeling, and help to focus our resources in the correct manner and try to find those cases which are truly fraud. Now, when we find those, we turn those over to our legal people, and they present them to the correct authorities.
And you've actually gotten an award for this.
Yes, we were very lucky. In 2009, the National Healthcare Anti-Fraud Association presented us with the Investigative Excellence Award. And that was the first time that award had ever been presented to a public enterprise. This group estimates that fraud is now increasing to the point of nearly $100 million a day. Wow. And I'm talking about fraud, waste, and abuse.
Now, seniors are particularly targeted for fraud. Can you tell us about that?
Yeah, absolutely. Seniors have been targeted for fraud for quite a long time. Now, one might think, well, why is that? And I think that's because the scammers think that here's an individual who probably isn't aware of what's going on quite as much as others. And if we look at the Patient Protection Act, there was a certain dollar amount that was set aside to create a task force that specifically targets healthcare fraud. And these are seniors under the Medicare situation.
What are some examples of this kind of fraud?
You know, the type of fraud that we're seeing is broker fraud, where you'll find a broker going out to a house, selling a particular product to a patient, and then that individual will pay them directly. Insurance agents, doctors are going to commit fraud in the same manner. They're going to bill us for services that were not rendered. They're going to bill us for services that were upcoded, which I mean another level of service that wasn't provided. And the one that's absolutely most disturbing that we're seeing is billing for non-medically necessary services, especially surgeries. You're going to find medical discount plans. Now, these medical discount plans may be completely fraudulent. You're not going to know that. You're going to pay your premiums. You're going to get a card, and when you go to use it, it's not going to be honored. And how do they target seniors? Especially in the prescription drug plan, you're going to find the same thing. You'll get a card, you'll pay that premium, you'll go to use it, and those benefits will not be honored.
So what can our senior citizen viewers, older people that are targeted, how can we protect ourselves?
If there's one thing you remember from this, it's guard your card.
Guard your card.
Make sure that you treat that health care card the same way you would your credit card. Give it to absolutely no one except the provider who's giving you service. Do not give it to anyone who comes up to the door, knocks on the door, and says to you, you know what, I'm from Medicare or I'm from Medical Mutual, and we're trying to update our records. Could you tell us your Social Security number? Mm-hmm. Absolutely, that's a scam. We don't do that. Medicare does not do that. Protect yourself from identity theft. I think you'll find that you need to keep accurate records. Why do you need to keep accurate records? We provide you with explanation of benefits, so does Medicare. You need to know what you're being billed for, what types of devices you're being billed for, and I'm going to tell you one thing. If you see anything there that you don't think is correct or accurate, you need to notify us about that. And that's the most important thing that you can do, is notify us if you see something. You can call us, you can write a letter to us, you can go to our website, and we will certainly look into that information.
All of this is so helpful because we're talking real money here. So to the extent that you can help save, avoid fraud, you're protecting our viewers and you're saving money for premiums.
Absolutely.
Well, thank you so much for your advice.
Thank
Very
you,
good
Armin.
help. So when it comes to fighting health insurance fraud, Medical Mutual is doing its part. Now we have to do our part. Follow John's proactive tips to avoid being conned. Stop fraud. Stopping fraud protects our pocketbooks and can help save us money. My thanks to John for joining us today.
Thank you.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com. Next, turn your term insurance into a moneymaker.